So prior authorizations can be big challenges for oncology practices. They're very time intensive. They can be very frustrating for the patient, the clinician, and staffs in the clinic. And so reducing them whenever possible can be very helpful. Malika Sharma and her group have a study that they're presenting here today where they showed that by collaborating with the payer, they were able to eliminate prior authorizations for a number of procedures, specifically for a number of imaging studies. And so, a lot of the things that we've talked about in this conference today and in the past few days have been the use of pathways to inform clinical care. One component of pathways can be imaging modalities, recommended imaging modalities, and things like that. So what Dr. Sharma and her group showed was that they kind of did a retrospective analysis of all the imaging studies that were ordered and required prior authorizations, and the number of tests that ultimately were approved. And about 97% of the imaging studies that they approved were concordant with the payer's recommendations and with pathway guidelines. So what they did is they basically came to an agreement with this particular payer that they would provide training to clinicians to ensure that all of the imaging studies that they ordered were concordant with some agreed upon guidelines, and basically had the agreement that if they were able to do that, then the payer wouldn't require any prior authorizations for that subset of studies. And it was essentially all imaging studies with the exception of PET scans. And so what their group demonstrated was that after implementation of this training amongst their clinicians, their adherence rate to the agreed upon pathways was 100%. And so they no longer required prior authorizations for that subset of imaging scans, which was the majority of scans being ordered.